Welcome to the Truman Charities podcast. I am Jamie Truman, your host. Did you know that 1 out of every 100 children are born with a congenital heart defect? In countries like the US, most cases are easily treatable and with a good prognosis for the child. But what about other countries that don't have the medical facilities or doctors to perform these surgeries? This could end up being a death sentence for these children. Save a Child's Life is based in Israel and has saved more than 7,000 children from over 70 countries. On average, they save a life every 24 hours and have been doing so for more than 25 years. So, how are they able to do this? And how are they able to get these children to their hospital in Israel? Also, how has that changed since October 7th? And how are they training doctors from all over the world? To discuss these topics, I spoke with the executive director, Rabbi David Litwack, and the DC director, Ronit Totah. I hope that you enjoy this conversation as much as I did. I'm really excited to talk about Save a Child's Heart and all of the great work that you're doing in Israel for children, worldwide, and also some of the missions that you have going on. But first, before we get into the organization, I want to know a little bit about your background. I know, David, you're the executive director, and Renee, you are the DC director for this organization. So why don't we David, why don't you tell me a little bit about your background and why you're so passionate about this organization?
All right. I've been the executive director of the U.S. office of Save a Child's Heart for the past 18 years. Before then, I was the director of development for the National Jewish Democratic Council. I've done a lot of work with Israeli and Jewish organizations over the years. I became involved with Save a Child's Heart just accidentally because I just ran into a doctor one day and asked him what he was doing. And he was Israeli. I asked him what he was doing in the United States, and he told me he was working for this organization that I'd never heard of before called Save a Child's Heart. If I can ever do anything to help you in your mission, because it sounds fantastic, I'd love to do that. And next thing I knew, an opportunity came around to create a U.S. office for Save a Child's Heart, and that's sort of how I got here.
Wow. Renee, what about you?
So my background is in public policy. I worked in the government in Israel in the Ministry of Foreign Affairs, and I came to DC about 15 years ago to work at the embassy. I was working on the Hill. I've always kind of worked on soft diplomacy projects, I would say, connecting people, connecting countries, bridging between cultures. That was sort of like my niche. A friend that used to volunteer for Save a Child's Heart told me they were looking for a regional director, and it was sort of like an amazing fit because I think the people to people component of this is so dear to my heart. That's how I found my passion here.
So, David, let me ask you, what kind of conditions are these doctors helping these children with? And what type of children are you helping and from where? Because I saw one on your website. It's kind of from all around, it's worldwide.
Yeah, we actually have saved the lives of more than 7,000 children from 70 countries around the world. So they really, we really literally save children from the four corners of the earth: South America, Africa, Middle East, Eastern Europe, China. Anywhere that you have children with pediatric cardiac issues that are not able to obtain the treatment they need within their own countries, that's pretty much where we've been. And the entire mission of the organization is to improve pediatric cardiac care in developing countries, because most people aren't aware of it, but congenital heart defects are the most common birth defect in the world. Something like 1 out of every 100 children is born with a congenital heart defect. In countries like the United States and Western countries, a lot of these conditions, you hear a child has a hole in the heart. So that's an example of congenital heart condition. In countries like the US, it's most of the time it's easily treatable, expensive, but easily treatable with very good prognosis for the children. But in countries that don't have the medical facilities or they don't have the doctors, it's a death sentence. And unfortunately, a lot of these children with this birth defect, there's sort of a window that exists in terms of if you do the surgery during that window, which could be like 2 years or so, they'll go on to live completely healthy, long lives. But if you don't, then they're doomed to really die at a very young age and in a lot of pain. Initially, we started just bringing children from developing countries to Israel for heart surgery. That's the way we initially started, just bringing children over, and we performed the surgery on them, and then they went back to their countries. And it started on a very small scale. And then as word started to get around that this organization was doing the work that it was doing, and then we started receiving inquiries from countries all over the world, and we started doing more children. We actually had to build a children's home in Israel to house children with their mothers, because in most cases, a lot of times there are underlying conditions that have to be dealt with before they can have the surgery. They could be malnourished, for example, or have other underlying medical conditions that have to be dealt with. So a lot of times they're in the children's home for weeks before they have the surgery and weeks after to recuperate. And then we expanded what we were doing to actually start doing medical missions abroad, where we'd go abroad, we would diagnose children who had congenital heart disease and put them on a waiting list to have surgery in Israel. And then from that point, at a certain point there was a realization that there's a limit to how many children we can treat.
Right.
Themselves. They're just, there are just hundreds of thousands of children who are born with congenital heart defects each year, and the ultimate solution is to enable countries to treat their own doctors. And that's what we started to do. We started to train doctors from developing countries. And we trained Ethiopia's first pediatric cardiac surgeon, and Tanzania's first pediatric cardiac surgeon, and Zambia's first pediatric cardiac surgeon. So now we're actually fulfilling our ultimate dream, which is to enable countries to treat their own children. And then they're sort of using Save a Child's Heart as a model for what they can do with their neighboring countries, which is what is happening in Africa right now. The founder of Save a Child's Heart, it's really a fulfillment of his dream. And really the icing on the cake really took place about 4 years ago when we built a new children's hospital in Israel that houses the Middle East's first international pediatric cardiac care center. And that enables us to treat more children from developing countries, to train more doctors from developing countries, and ultimately save exponentially more children every year. So I guess that was a mouthful, but
No, when I was researching your organization, I saw that there are a lot of doctors. I was going to ask you from kind of all over
right.
that were getting trained at your hospital. So now that kind of is all coming together. And actually, it was interesting when you look onto some of the children that have received treatment from you guys. There is this one girl, I think it's Moran, or I probably mispronouncing the name, but she was treated and now she has become a doctor herself. So that's got to
it's very there's a doctor
story.
There's a doctor in San Francisco right now who's Ethiopian who was
Really?
who was saved, Emmett Wasi, who was saved by Save a Child Heart as a child, and when she was saved, a lot of times when we save children, we'll ask them, what do you want to be when you grow up? And this child said, I want to be a doctor. And that's exactly what she became. And she's a doctor practicing in San Francisco right now. And it's very interesting to see what happens with some of these children after they're saved. There's one child who we saved from Ethiopia who he was an orphan, and we brought him to Israel for treatment. And he went on and founded an orphanage in Ethiopia. And actually, about a year ago, he brought one of those children with him from that orphanage in Ethiopia to Israel for treatment. So
Wow.
it's kind of amazing to see what happens with these children. You save one. We like to say there's this Jewish expression: if you to save a life is to save a world. And when you see what happens with these children after they're saved, and the impact it has upon the villages they come from and the communities, it's really quite rewarding. We're about to celebrate our 30th anniversary, so we can actually see what's happened with a number of these children, what they've gone on to accomplish. It's very fulfilling to see.
So I'd like to know, how is the process for you guys? So what happens when you do find a child in need? Like, tell me exactly how that works.
Well,
Question.
okay, so it's at this point we're fairly well known uh, in developing countries, and that's actually how we got when we first started almost 30 years ago. The founder of Save a Child's Heart, the late Dr. Ami Cohn, um, decided he wanted to devote his life to improving pediatric cardiac care in developing countries. Um, and one day he got a call from a doctor in Ethiopia. He said, "You know something? We got 3 cardiologists in Ethiopia. Um, we have no pediatric cardiac surgeons. Um, so we hear about this crazy guy in Israel who's trying to do something about this problem. Can you help us?" And he said, "Yeah." And he got on a plane, flew to Ethiopia, picked up 2 kids, put them up in his apartment, performed the surgery on them, and they recuperated in his apartment. And that's how things started. It
This
started.
is Jamie. This is Dr. Ami Cohen, the founder of Save a Child's Heart, who started this 30 years ago in his apartment, basically in Israel.
Yeah, I mean so it started from word of mouth, and at this point there really is a global awareness of what we're doing. We had in 2018, the United Nations gave us one of their highest awards, the Population Award, in recognition of the work that we've been doing in transforming pediatric cardiac care in Africa. So it's we don't have to look for children anymore. We get referrals all the time. We still do diagnostic missions to various countries to identify children who need treatment. But I can tell you a funny story. A few years ago, I thought I had this really bright idea that we would start doing Google ads, because Google gives grants to not-for-profits. So we started doing all these Google ads. We did not raise 1 penny from these Google ads, which didn't cost us anything. But you know what happened? We got inundated with emails and phone calls from desperate parents all over the world, desperate to find ways to save their children. They knew they had a child with a congenital heart defect. They could not get the treatment in their home countries. And through the Google, it was like, there's an organization that actually out there that could help. And the thing about what we do is the doctors who do the work for us do it as volunteers. The cost of treatment are fairly, compared to the United States, for us, it costs $15,000 to save a child. That includes all the surgery costs, hospital costs, room and board in the children's home for 3 months. It's sort of a package deal. And that's regardless of how long they stay in the hospital, how complicated the case is, how many surgeries. In the United States, it's just routine pediatric cardiac surgery could cost, $100,000. So that's, and I have to say that in most cases, like 95% of the cases, these families cannot afford the surgery. And much of our fundraising is related to raising the funds for these surgeries. But we've never ever turned a child down because they did not have the funds for the surgery, and we never will. It's a losing proposition for us financially, but it's a winning proposition for the children and their families.
So I heard you mention that the duration is about 3 months for
Right.
these children. Is that about right? For
Yes.
the average child will be staying with you guys for about 3 months, and that's surgery, and then afterwards for
Right.
recovery as well, right?
Right.
Okay. And I did want to ask you a little bit about how your organization has changed, if it has at all, in Israel since October 7th.
That's a good question. I'll let Ronit answer that.
And I think, thank you, David. No, it's been a rough year. It's still ongoing. Obviously, the situation is still ongoing and unfolding. I will say on the day of October 7th, so Save a Child's Heart is basically there's the children's home that David mentioned. We also have a children's hospital that's really state of the art, and it's situated within the Wolfson Medical Center, which is a larger hospital that's situated in the south of Tel Aviv in a city called Holon. Um, and it's really like a central area. It has a lot of different populations in the area. One of the largest concentration of Holocaust survivors lives in that area. A lot of different immigrants, many sort of like people from like, I would say, lower social status go to this hospital. And it's a really beautiful hospital. And on October 7th, with all the attack and all the casualties, Wolfson Medical Center received about 400 casualties to its hospital from various sources because there was so much stress in the south. The hospitals that were treating in the south, people basically took their cars and drove north to try to get to the nearest hospital, and they reached Wolfson. So Save a Child's Heart in that moment basically realized we really need to pivot. Not only like we're still obviously doing our life-saving work, we're saving children, we're doing surgeries, but we also need to pivot and help the greater the hospital and what's needed there. And we basically started an emergency campaign to help the hospital raise funds for them to have consumables, because the way it works in Israel is that every month you have sort of like the emergency consumables for the hospital, and we needed to have more consumables for the foreseeable future because we also didn't know how many other fronts are going to start. We're seeing the north now heating up, but we really needed the hospital to be ready. So a lot of our emergency funds were going for consumables. It was also going for equipment that was needed. It was also going to prepare the hospital for emergency mode. So in that sense, babies from the NICU were going to our hospital, because a lot of our surgery rooms, a lot of our other floors are protected, they're underground. Surgeries were still surgeons were still able to operate under the ground. They had shelters in case they needed to go into shelter, which they needed a lot of times. So we were just really well equipped to help. The hospital was also, our children's hospital was also able to accommodate hostages that were coming back. Which was also very, very emotional. But we were able to treat and have space for families to come together. The department was completely isolated. Only the doctors that were needed, only the social service people were there to support the people that were coming back. But the families really had space to reunite with their loved ones when they came back. So that was, something huge that Wolfson Medical Center and, in partnership with Save a Child's Heart Hospital, we did it together. So to answer that, I would say, and I guess it's all in tandem, so we're still doing our work. The doctors are still volunteering. They're still doing their surgeries. But at the same time, we're also really, really helping the greater impact that's happening in the hospital and in large in the greater health system in Israel. Wolfson Medical Center was chosen as one of the 6 hospitals to accept all the people that are coming back. Hopefully, I hope the rest are coming back soon. But yeah, that's sort of the dual pivot I would say that we did since October 7th.
I just want to add to that. After October 7th, it created a very unusual situation for us because we still had a lot of children. We had a lot of children that were in the children's home, and all the flights in and out of Israel were canceled. So we were in a situation where we were really working feverishly to try to get these children back to their home countries while this war was going on. And, for, a couple months, we were not able to really bring children to Israel for surgery. But what I found was really extraordinary was by the time we hit December, at that point, we actually started to bring children from Africa into Israel for surgery. And we've actually been doing medical missions this year. And when you think about it, it's kind of extraordinary that you have, and I really marvel at this. Here you have a country at war. It's in the middle of a war, and at the same time, it's in the middle of the war. It's still engaged in doing these humanitarian missions to Africa to bring children over for treatment, and they're doing medical missions as well, which is, it's the kind of story you'll never hear about. You'll just never hear about this story. You'll never see this story in the media. But I find it extraordinary that in the middle of a war, you've got this country doing these medical missions where, I can't, I just can't, I just can't remember another country where they're in the middle of the war. They're doing humanitarian missions abroad. I just think it's astonishing.
Right.
I will also add, oh, sorry, just one
No,
last kind of,
go ahead.
anecdote. Another interesting thing that we've seen is that, like David mentioned, we have our staff, they're doing reserves, everybody's being called up, everybody's knowing somebody that either lost somebody, or like it's all interconnected. We also have our doctors who are doing training in Israel who are coming from different countries, and they, in this moment, chose to stay in Israel and continue their training, which also says a lot. They're in the middle of a war. The fact that they're not going back to their families, the fact that they're deciding to stay. We have one doctor from Rwanda, for example, who decided, she actually is a survivor from the Rwanda genocide. This was very triggering for her. And she decided to go back to be with her family, and ultimately, after a few weeks, flew back to finish her training because that's what she wants to do. That's what she wants to become. This is important. It's important to support the children right now, and that's what she's going to do. So it's all these little stories of just heroism that we're seeing.
Wow, that's pretty incredible. And I know that, David, you mentioned you're not going to hear on the news, but that's why we're here on the podcast. So plenty of people are going to be hearing this incredible story because I didn't know. I never heard this. So that's wonderful. And I want to hear a little bit about some of your missions. Is there one mission that in particular stands out to you?
Actually, 2 years ago, we had a mission to Ethiopia that Ethiopia was where we started, Save a Child's Heart, and we held a mission to really. It was a celebratory mission. It was really the last mission that we really needed to do to Ethiopia because we had trained Ethiopia's first pediatric cardiac surgeon and the entire pediatric cardiac team that was working with him. So it was, on the one hand, it was sort of a farewell, but it was also a celebration of what we've achieved. And there actually was a reunion of all the children and their families from 25 years ago that we had saved. And that was really an incredibly emotional, moving moment to have all these families and children together that we've saved and transformed over the years. I think that was the most memorable one.
How often are you two, if you are able to go and actually visit the hospital in Israel?
Well, before the war, I would do it on a regular basis, and we actually were scheduled to have an international conference in Israel in last October, and my flight was scheduled to fly to Israel on October 7th, and my flight was canceled, as all the other flights were, and it was going to be an international conference where we would have had affiliates. There's a Canadian organization and a British organization and an Australian organization. God willing, we'll have one soon. When I don't know, but under normal circumstances, the answer to your question is pretty regularly.
Right. What was it like when you would go and visit the hospital in Israel?
On a personal level, it was very moving to see the children in the hospital, the families. It was very moving to see all of the people from differing backgrounds, ethnicities, religions can accomplish when they work when they're working together for a common cause. And when you were in that hospital, you saw you saw Palestinian doctors working with Israeli doctors, with African doctors, treating children from every ethnicity and background you could possibly conceive of. You you just entered a place where the world there was the way you'd like the world to be.
Mhm.
Oh.
Was it difficult at all with having people coming from all over the world when it comes to being able to communicate?
You don't have any problem in Israel in terms of translation. The problem is sometimes we had problems from people from parents coming with children from parts of the world that
Hmm.
are so remote that they speak a dialect of a dialect of language that virtually no one speaks. Where we've had to give them pieces of paper um, that explains to the airline personnel exactly what their needs are, where they're going. Occasionally, it has been a problem. Not so much when we get them to Israel, but sometimes getting them from whatever remote village they're coming from can be a real challenge. So
Right. I didn't think about that. How can people in the US help your organization?
the biggest help that people in the United States could make would be to support us with donations. And people can they can earmark donations for saving for surgery. They can email. They can earmark their donations for training doctors. It's completely open, but it's that's that really is, I think, the way to have the most significant impact. And I also think what you're doing in terms of this podcast is extraordinarily important because there aren't that many people in this country who are aware of what we're doing. So the more that we can make people aware of what we're doing, the more money we'll be able to raise to save children. It's once people understand what we're doing, we find that they're very responsive to helping us achieve what we want to achieve. But our problem is most people aren't aware of what we're doing. So I can't tell you how much we appreciate what you're doing because it's a real challenge to really get people to make people aware of what we're doing.
Yeah, I will say, Jamie, like I think it's a challenge to also see news that are positive, so exactly what David is saying, like we're so appreciative of what you're doing and just hearing more about the good that is in the world and trying to focus more on the light.
Right.
That will amplify darkness. I truly believe that. And I will say, in terms of Save a Child's Heart, we have presence in the US. I'm more like the DMV director. We have presence in New York. We have presence in Miami, Atlanta, LA. So, locally, I think our goals are also doing outreach in the community and amplifying, obviously, our fundraising efforts. But, if anyone is in those areas and wants to hear more and kind of do more locally, whether it's hosting a parlor meeting on, a fundraiser or trying to connect with children when you go to Israel. If you want to visit the children's hospital, you want to visit the children's home, like those are opportunities to connect with what we do.
Yes. And I'll make sure in the show notes that we have your website and how you guys can how people can follow you on social
Great.
media. And yes, and I did notice that you guys even have volunteers that come to Israel to help
Correct.
out for the summer. I
Correct.
saw a
It's
lot
actually
of,
a really beautiful, yeah, it's a really beautiful way for people to connect with children that are, staying for a long time. They're not in their home country. They're speaking in a different language. It's a beautiful opportunity, to have volunteers come and connect with these kids.
so before I let you both go, is there anything that we haven't covered?
Yes, for me, the message is like, I think you say this all the time, but like the more you help others, the more you help yourself. So just focusing on the good and trying to, have more people do good out there. Thank you for spreading all this
Oh,
awareness all around, Jamie.
oh my gosh. And thank you both for coming on to speak with us. I learned a lot. I didn't know about your organization until probably about a month ago when I was introduced to it. And what you guys are doing is incredible for children all around the world. And training doctors from all over is, everything that you guys are doing is quite incredible and remarkable. So thank you for all the work that you do. And I want to thank everybody for tuning in to another episode of the Truman Charities podcast. Until next time. What an incredible organization. I learned so much from Save a Child's Life and how we can help children from all over the world that are born with a congenital heart defect. Now, if you liked this episode, please make sure to rate and review it. I read all of the reviews and they really do count. So make sure you go on your Apple app, press that 5 stars, and then rate a review. And while you're at it, click the subscribe button so you don't miss any future episodes. If you'd like to follow us, you can follow us on Facebook at Truman Charities, Instagram, Jamie_Truman Charities. You can follow me on LinkedIn at Jamie Truman. And go to trumancharities.com, sign up for our newsletter. And so you don't miss any of our upcoming events. As you know, that we host 3 large events per year. And then we also do Bethesda's Best Happy Hour, which are some fun networking events as well throughout the year. As you know, I wrote a book, Vanishing Fathers, The Ripple Effect on Tomorrow's Generation. 100% of the proceeds from the book go to charities that help at-risk youths. So far, we have raised a little over $80,000, which I am very proud of, and I could not have done it without you guys. So thank you very much. You can go to Amazon or any online bookstore to purchase. Thanks again for tuning in to another episode. If you liked this episode, please make sure to rate and review our podcast. That is how more people learn about the Truman Charities podcast and our organization. And to make sure you don't miss any of our future episodes, subscribe. If you'd like to follow Truman Charities, you can follow us on Facebook at Truman Charities, Instagram at Jamie_Truman Charities, and check out our website, trumancharities.com.